Hi, this is Jordan Visco from ClinicAid. I'm creating this quick video today to detail some changes for our Alberta clients that are coming into effect of April 1st, 2014. And we're going to show you how to handle those changes within ClinicAid. So as you may know, there's a new schedule of medical benefits that's available April 1st, 2014, and you can find it on the health.alberta.ca website under Health Professionals, Fees, Schedule of Medical Benefits. And if you're looking for some information on exactly what changed, if you actually just Google AMA Billing Corner April 2014, this page comes up. And here, I'll show you. Click enter there. And it's the first link on Google here. And if you click on it, you get a full list of all the things that changed. And you can download a PDF. And you can see all the highlights down here, and you can read all about it. But I'm going to go through a few things and show you how we handle these changes within ClinicAid. So first of all, there's a bunch of new service codes that are available to use after April 1st. For example, there's a new one called 03.05 GA. Now you notice when I search for 03.05 GA today, and today is 3 March 31st, there's actually nothing that shows up in the search results because this particular code isn't available for this particular date. So instead, if I change the date and I go to April 1st, and then I put my cursor back in this box here, you can see it finds it now, 03.05 GA. And then I can go and fill out my line item and click add, and I can bill for that $40.58 for the care of healthy newborn in hospital. Now, if I did decide that on May 31st, where I originally wanted to bill for today's date, if I did go through and add a diagnostic code and add a patient here, and add this line item to my bill, and I got it down here. If I did try and bill for this for a service date of March the 31st, if I try and click save, it's actually going to give me an error and tell me that the service code is not valid for the date. So we're doing some checking here just to make sure the service codes that you're sending are valid for the dates. I'll go through another one here. Let's delete this line item, and we'll try like a 03.44 A. Now you notice again, it doesn't show up in my search results because the date is selected as March 31st, but if I go to tomorrow's date, April the 1st, 2014, put my cursor back in the box, oh look, it finds it, and then I can go ahead and add my diagnostic code and click add, and when I click save, it's going to work. There's a whole bunch of service codes that have been added, and that's just an example of two. There's also been a bunch of service codes that have been removed, and so if you try and submit those after April the 1st, they're not going to work. And so just a quick example here, I have a 03.05 NT. Doing a search for it, it's not showing up because this is a code that's not valid after April 1st. And if I go and I choose March 31st, and put my cursor back in the box, it finds it there. So that's kind of how we're handling it in ClinicAid. We're trying to make it as simple as possible for you. One of the major changes that happened was there's actually a change to the COMX modifier, which is fairly heavily used in hospital billing. And so again, we're just going to go and add patient Mickey Mouse here. And we're going to look for the 03.03D for hospital visit. Now, this code is valid before and after March 31st. But if I go over to the fee modifiers box here, you'll notice that before March 31st, the available fee modifiers are COMX and TOC. And if I actually change the service date to April 1st here, and I go back to the fee modifiers box, you'll see that the COMX modifier is gone and it's now replaced by the COINPT modifier. So if you're doing complex care in hospital billing after April 1st, you're going to need to use this new COINPT modifier. And that's again in this billing corner post by the Alberta Medical Association. You can read all about that COINPT modifier and how it's replacing the COMX. Another thing to note is that the service price has changed. So on April 1st, the service for 03.03D, the base value is $40.58, and the base value beforehand on March 31st um, was actually only 33.82. So you can see the price of the 03.03D increased. The price in ClinicAid doesn't actually matter to Alberta Health what we say in here. What matters to them is the code. So even if you sent a 03.03D for a date after April 1st and you thought that the price was going to be 33.82, but it was actually much higher than that, even if the price in ClinicAid shows as 33.82, they're actually going to pay you what's valid for the particular date. So don't worry too much about the price. We have tried to update the prices, where we can, but the price doesn't actually determine what you're going to be paid by Alberta Health. They determine the prices on their own. Aside from that, those changes, there's some changes to a bunch of the facilities. There's a bunch of facilities removed and a bunch of facilities added. Again, those are all selectable by date within the system, but 99% of people aren't going to need to worry about their changing facility numbers if the facilities are removed. That's just because they no longer exist or in the system. So thank you very much for sitting through this quick tutorial. If you have any questions, please contact us. You can contact us at support@clinicaid.ca. And you can also contact us by phone at 888-686-8560, extension 2 for support. Thanks a lot.